With trauma, think about it as anything that's less than nurturing. When you think about the different types of trauma, it's all in a continuum. So it could be from covert abuse all the way to overt abuse. Covert abuse is less observable, and it could be things like enmeshment, neglect, abandonment, emotional abuse, spiritual abuse, and overt abuse is more observable, and they are things like physical abuse, verbal abuse, sexual abuse, keeping these things in mind as we are walking through this process today. Okay, the next thing that I want you to do is have this visual, and it was the way that I was taught, and so I really like it, and it's also a way for clients to be able to get a certain framework when it comes to their own lives and why they're acting the way that they are and how to be able to change that. To start off with, having this visual of a tree in your mind, with my artwork here, and our trauma is under here, so the roots of the tree, and we're going to look at how that leads to symptoms, so our leaves on the tree. And each leaf represents a symptom, and these symptoms are usually why people come in to see me in my office for therapy. They're things that are impacting someone's life, and they're impacting their relationship or at work or home or school or their health, and they are out of control behaviors, or they are completely inconvenient, or they're very destructive and can be toxic. Thinking about with addictions and also mental health issues, so anxiety, depression, and breaking these down a little bit. Addictions with two categories, chemical addictions and process addictions. Chemical addictions are drugs, alcohol, prescription drug abuse. Process addictions are things like food, work, sex, spending, porn, gambling. I'd even put in there screen addiction or social media, Instagram addiction, all of that. And when you look at anxiety, so the symptoms there, it could range from nervousness all the way to panic attacks and phobias that are impacting your daily functioning or your ability to do a presentation at work. So it can come and show up in different ways. Depression can range from dysthymia all the way to major depressive disorder. We can also have on here self-harm thoughts, self-harm behaviors, suicidal ideation, different ways of acting out that impact our relationships and, of course, impacting our daily functioning. Okay, so those are our symptoms. Now, looking at what leads to that, and we can categorize them in 5 different ways. They are our core issues. And when you think about these core issues, just keep in mind where you land on one side or the other. And of course, they can range or vacillate, but typically will fall in one side or the other. So the first one is self-esteem. When we compare ourselves to other people, I'm less than them, I'm better than them, going one up or one down. The second category of core issues, boundaries. I have a whole other video explaining this in more detail, but right now, we're just going to stick with when we go to a place of being too vulnerable or being invulnerable, walling off. And the third category of our core issues, reality. When we think of reality, we go from one end of the spectrum of perfectionistic all the way to rebellious. The fourth would be our dependency. So when we're too dependent on other people, or we are anti-dependent and we refuse to ask for help or accept help. And then the fifth category would be moderation. And this is when we go from the extreme of being out of control or being all the way and being too controlling. All right, so looking at where we stand in terms of each of these core issues and what is driving all of this, what's feeding all of this. So the roots are our trauma, and going back and revisiting, looking at our trauma as anything that's less than nurturing, one end of the spectrum to the other, and looking at whether it's covert trauma, whether it's overt trauma, whether there's unresolved grief. There's also the experience of a faulty belief system. So looking at whether you have irrational thoughts, whether you have self-defeating thinking, whether there are toxic belief systems going on. I'm not good enough. Something is defective with me. I'm a loser. Going into an all or nothing place. Personalizing. So looking at these different areas that are unresolved and how they impact your core issues in these areas, which lead to these symptoms that we end up seeing, and being able to get an understanding around that. When you think about this, think about what your own tree is and being able to label that, and recognizing how, when you take care of one symptom, it could also pop up and lead to another symptom if you don't address those underlying core issues. You can switch addictions. It's really important to look at those underlying areas of the trauma, unresolved grief, and those core issues. The next thing I wanted to talk about is fine. So once you know all of this and you have that understanding, so now what? What do you do with it? It's crucial that you get professional assistance and support with a therapist, being able to guide you and walk you through this so that you are not opening up wounds and not getting the proper help through them and then re-traumatizing yourself. We definitely don't want that. So being able to walk with a therapist through these issues, one way is through a modality called EMDR, eye movement desensitization and reprocessing. So that's one technique that some therapists use. It's a way of addressing bilateral stimulation. So bilateral is hitting the left brain, right brain with certain tools that they use and techniques so that you can reprocess and heal some unresolved trauma. That's one approach. Another approach is to do some cognitive behavioral therapy, which is CBT, and that can address those faulty belief systems, reprogramming the way that you think so that it changes how you think, which changes how you feel, and then it ultimately changes your behaviors and how you are interacting with the world and your relationships. Okay, the other way that I like is through reparenting, and this process uses the approach of looking at parenting as having 3 jobs, and it's nurturing, affirming, and setting limits. And when you think about that, nurturing your inner child would be to look at your needs and wants, being able to take responsibility. What are you doing to contribute to the problem? What are you doing to contribute to the solution? Being able to step out of that victim role or the offender role. And then affirming. So affirming is your self-talk and being able to be kind and loving and in a space where you are promoting growth. And so instead of thinking something's wrong with me, I never do anything right, I'm such a loser, nobody gets me, being able to affirm the self and say, I'm okay, I'm trying the best that I can, what are my options? It's more of an encouraging self-talk. Then the last reparenting part is setting limits. So that's where the boundaries come in and being able to be assertive with the self and also being able to set those limits of containment. And when you think about this process, just keeping in mind being able to apply it in a way that is nurturing, affirming, and setting limits. So similar to how you would do with a child when you're parenting, but treating yourself with that same respect. All right, so these are just a few approaches that people take when it comes to addressing trauma. And if you have any questions, let me know. I hope that this was helpful, and I will see you guys next time.